Hi, my name is Alan Banks, and I work for GuidedSMILE. And today we're talking about AI in dental, and we're talking about it with a company called Valmeni. And Valmeni is at the forefront of that topic. And I'm sitting here with Minnie, who is the CEO and founder of Valmeni, and Doug Gillespie, who is in charge of development of the company. And we talked about an awful lot of things today, but I thought maybe we would just talk about Valmeni and what you do. What is your interest in dental, and what is your main mojo with dental right now?
Great question, Alan. By the way, I'm not a dentist. I came into dental AI by destiny. Valmeni is for automation using AI. We believe what we can do with using AI, actually look at all kinds of radiographs, pick all the findings, and help the dentist be more efficient. It's not that our dentists don't know what they're doing. It's just the way the dentistry is performed. They're busy people. They can miss diagnosis. They can miss findings. With AI, it can actually help to identify or at least alert those things which the dentist's keen eyes can miss. So we are a decision support to the dentist. And AI could be used for any kinds of radiographs, images, doctor's notes, you can name any of these kind of content. And that's where Valmeni would like to bring an automation and help different products be more efficient.
So this is essentially software where you plug in the data, whatever that is coming from the dental office.
Right.
Your software analyzes it, looks for problems.
Exactly.
Problems only, I suppose. That's the main thing. And then the doctor can either choose to follow what your software is telling them about that patient. They make some educated decision and then address the patient, but it's going to hopefully shed some light on that patient. Things they probably could miss because there's so many variables out there, and you really only have a few minutes.
Absolutely, and you're absolutely right, Alan, here. I say that the doctors are in the driving seat. They are the decision makers. They are the ones who are going to accept or reject any of those things. Radiographs are just one part of the whole diagnostic, I would say routine. They're also looking into patient's mouth. They're also looking at other indicators. What we do is basically we can help them get more, as I said, more efficient so that they don't miss this kind of things. I call it X-rays as 256 shades of gray.
Okay.
Right? So, and it could be confusing, especially when the dentists are young into practice, they don't have enough experience, and God forbid, the COVID batch, right? Who did not have enough hands-on. AI can help the dentist get more smarter or more efficient and use their time with the patient so that that extra time can be saved.
It's almost like having a super expert in the room.
Exactly.
at your beckoning call. And that was radiographs, but Doug, who's a CBCT expert for many years now, this is also falling under this umbrella, right? I mean, everybody has CTs now. It's like 60% of the country's got a CBCT, so they're taking them.
Yeah.
And they're going to need some analysis.
Exactly. And so what do you do with that DICOM file? And so AI is a great segue into that. So Valmeni's working in the 3D space. So it can take a DICOM and turn it into an STL, so you can actually rotate it around and look at it in 3D. That's fantastic, especially if you ever show the patient their jaw or their maxilla or their cranium, their whole face in 3D and rotate it around. You just take your practice to the next level, showing them that. And of course, on the laboratory side as well too, designing full mouth cases, things like that, identifying lingual nerves, all of that type of situation really just elevates your quality of care and quality of restoration. So.
And I think you're analyzing not just the oral environment, you're able to analyze the skull, the pathway, like all types of anatomy that you're going to get from a large FOV of a CT scan, right?
Exactly, the airway, of course, the TMJ as well too, mandible, maxilla, lateral canal, all important aspects to know when you're doing a case, or even in a sleep case as well too. So
yeah, that's wonderful. And as you know, that's why we're here. It's all we do is deal with CTs all day, from simple one implant cases all the way to full mouth reconstruction. We need to know these types of things too, because we have to communicate with the doctor. We have to raise awareness. We have to plan these complicated cases. And for us, yeah, we have some experts, but wouldn't it be nice to always have an expert telling us exactly what's going on with that patient? So that's our interest in your company. So this has been a very good discussion today, and I know we're going to unveil some pretty amazing things in the coming months and years. So
I just want to add one thing. AI is the future, and AI is here. Everything, it's not just the dental, but healthcare, name any other field, everything is now touched by AI. AI, in my short version, I say AI is the fastest way of getting to the precision or precise data. And if we can do that through using AI algorithms or AI method, all we do is basically bring efficiency in any workflow. So I feel dental is another area which needs a lot of efficiencies. There are a lot of disconnected systems. I think with AI, that can be bridged.
yeah.
And I just want to end with this. From my side, I always say AI is intelligent, but the doctors are wise.
Very nice. Yeah. All right. Well, I'm looking forward to all this myself immensely. So thank you very much.
Thank you, Alan. Thanks for having us.
Thank you, Alan.